List of things that will disqualify you from surgery. All right, smoking. If you smoke, I don't care if it's a vape, I don't care if it's Marlboro Lights or Newports, you can't have surgery. Comes with too many risks, too many complications.
Oh, yeah. Well, big smoker.
Number two, BMI. If your BMI is over 40, probably not a good candidate for surgery. Why? There's associated risks with anesthesia, there's an increased risk of complications, and more than likely, you're probably not going to get that desired outcome.
Sad.
All right, if you're diabetic and your blood sugars are uncontrolled, or your hemoglobin A1C is above 7 and it's not going in the right direction, you can't have surgery. It's just too risky. I don't want to end up with a patient with wound healing issues or a patient that ends up in the ICU because their blood sugars were uncontrolled. All right, you recently was discharged from the hospital because you had a pulmonary embolism, or you just recently had a PE, or you have a blood clot, or you have a history of a blood clot. We need to know these things because you're not a candidate for elective surgery. Hypertension, and you do not take your medications regularly, and your blood pressure is out of control, you're not a candidate for surgery. You do not have a caregiver after surgery. Not a candidate.